Good day, everyone. You're welcome to the lesson of today. Hope you've had a lovely night rest, and I hope you are ready for the work of today. My name is Adedayo Adegoke, and today we'll be considering the subject Basic Science and Technology. Our focus is on PHE, and our topic, as you can see on the screen, is HIV/AIDS Education Part 2. Actually, we've started this lesson we did it in our previous lesson, this topic. So we are looking at the second part of this topic. In our previous lesson, we learned about the meaning of HIV/AIDS and how it can be contracted. But in this lesson, we are going to be studying the ways HIV/AIDS cannot be contracted and how to prevent it, because prevention is better than cure, as you all know. You're welcome once again to this lesson. My name is Miss Adegoke. Okay, at the end of this lesson, you should be able to define HIV/AIDS, recite and write the full meaning of HIV/AIDS, mention how HIV is contracted, mention how HIV is not contracted, and list ways to prevent HIV infection. Okay, we've learned what HIV/AIDS is in our previous lesson. HIV is a bad germ which attacks the body and makes one very sick. It is a bad germ which attacks the body and makes one very sick. And what happens? The body becomes weak and unable to fight sicknesses. Okay, the HIV enters the body, destroys the body, and then when diseases or germs come, the body cannot fight them because the body is now weak. And it is also HIV that grows to become AIDS. We've seen what HIV means. HIV is human immunodeficiency virus. That is human. It affects only human beings. Immunodeficiency. That is, it makes the immune system deficient. That means the immune system cannot work properly. That's why we call it immune deficiency. It is now deficient. It cannot work properly like it should. Then with the V means virus. It is a virus. And then AIDS, as you can see here, the meaning of HIV, it is AIDS that is the latter stage of the disease. Somebody has HIV and it grows to become AIDS. AIDS is acquired immune deficiency syndrome. Acquired immune deficiency syndrome. That's what AIDS is. And we saw some facts about a lot of people have died. 35 million people have died because of HIV, 76.1 million infected, and 1.8 million new cases in 2016 alone. It is a disease that you should be careful not to have. You have been told that the disease, once it gets into your body, it cannot go away, and that is why you must make sure you don't have it. This is a HIV victim. You can see weak, cannot do anything, helpless, because the disease has destroyed the internal body parts. You are strong because your immune system is working well, though you may not see them. Your body has covered it. A lot of things are inside your body, your stomach, your chest. A lot of organs are there. The heart is there. A lot of things are there helping you to stay strong, processing the food that you eat. And then when this HIV enters the body, it destroys these vital organs. It gets in the blood, and the blood circulates around your body. So it goes around the whole of your system, because the blood that is in your head is one that will flow around your body and comes back and keeps flowing. So HIV keeps moving, and then it destroys the person. That is why you must be careful to ensure that it does not enter your body at all. These are some other HIV victims. You can see them lying helpless. Okay, how do you know if somebody has HIV? It is not because the person is thin. Some people have HIV and they are fat. They are eating good food. They are okay. Okay, but the HIV is still there. How do you know if somebody has HIV? You cannot rely on the symptoms. Oh, don't say this person is thin. The leg is thin. It's like this person has HIV. No. The only way to know for sure is to do what? Get tested. You get tested. That is, you go to a hospital, then they check your blood, they screen your blood, they test your blood, and then they will tell you whether the person is HIV negative or HIV positive. Negative means does not have, while positive means the person has the virus. Okay, now we mentioned that HIV is contracted. I hope you still remember that it is through the use of other person's blade or clippers, and also through blood transfusion. When somebody needs blood and then they give the person a blood that has HIV, that person receiving the blood will have HIV because the blood will be passed into his body. Then we also mentioned using sharp objects of other people, such as the pins, needles, syringes, blades, clippers. That is why you must be careful. Okay, don't borrow all these things, have your home. Then sharing of toothbrush or chewing stick with an infected person. You know HIV is passed through blood, so you must be careful that somebody's blood does not get to you. Then exchanging blood through cut and friendship. This is also a victim of HIV. Okay. Now we want to look at ways in which AIDS cannot be contracted. Ways in which AIDS cannot be contracted. We have seen how people can get it. Some people say, oh, if somebody has HIV/AIDS and you shake hands with the person, then you too you will have. No, 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 no. You cannot have AIDS by shaking hands with an infected person. You know, you've been told that HIV is passed through what? Blood. When somebody's blood or when an infected blood gets in contact with someone's blood, the virus is transmitted. So if you shake hands with someone who has HIV/AIDS, you cannot have it. Another way in which you cannot have HIV is through insect bite. So if you say, oh, if mosquito bites you and the mosquito sucks your blood, you can have HIV. That if mosquito sucks the blood of somebody that has HIV and then mosquito come and bite you too, then you can have HIV. No, no, you cannot have HIV through insect bite. Do you remember that we said that HIV is a human immunodeficiency virus? It affects only human beings. It does not affect animals. Is that taken? So animals cannot pass it. Another one is sharing cups, spoons, or towels with an infected person. You know, you can share cups, you can share spoons. So far, blood is not mixing. You know, when you share cup, somebody drinks water or you want to pour out of your tea into someone's cup, it doesn't mean that you will pass the virus or the virus can get to you. No. So you can share cups, spoons, towels with an infected person, you won't have HIV. Also, playing with an infected person. Okay, if your body touch one another or each other, you can't have HIV. So you should play with them. They are human beings, just that they have a sickness in their body. You know, if you're having malaria too, it doesn't mean that mommy or daddy will throw you out of the house. They will take care of you. If somebody has an accident, people will take care of the person. If somebody has HIV, the person needs to be taken care of. Just that you need to be careful so that the blood does not touch your blood and so that you don't get infected. So you have to be careful, but it doesn't mean that you have to isolate the person. That is, you make the person feel like he or she is not worthy again. So you can still play with an infected person and you won't have the virus. Also, we have eating from the same plate with an infected person. You can stay at the same table, eat together. You can even eat from the same plate, you know, and you will not have the virus. So the virus is not spread just by eating. You have been told that it spread through what? Blood. When blood comes in contact with an infected blood comes in contact with somebody that does not have HIV, then they have it. Another way you cannot have HIV is talking with an infected person or laughing with them. You know, I've mentioned it earlier that somebody has HIV does not mean we cannot play with them. We have to be careful, but you play with them, you talk with them. Okay, just make sure that anything that has to do with blood does not happen. Okay, you can talk with them, you can laugh with them, you won't have the virus. Now, how do we prevent HIV? Number one, what do? Report all injuries. Anytime there's an injury, whether minor or a major one, maybe something just caught you and a little blood is coming out, or it is something that is a little bit, maybe you fell down and then there's bruises on your body, make sure you report. If you're at home, report to your parent or an elderly person. If you're in school, you report to your teacher. Anywhere you have reports, so that wound can be taken care of, so that the wound does not get in touch with an HIV blood. Okay, so you must report all injuries. Another one, do not play with sharp objects. Very, very dangerous. Apart from the fact that it can cut you, it can give you HIV. So you don't play with sharp objects. Use your own clippers and blade when at a barbing salon. If you cannot cut your hair in your house, you have to get to the barbing salon, then take your clippers with you. Avoid sex before marriage, okay? People should not get into relationships that can give them HIV. As young children, you are not ready for marriage yet, so you should avoid relationships or doing things that are not right. It can also cause HIV. The nurses and doctors should use a new needle for each patient, okay? You inject someone, okay? And you may say, oh, I'm not a nurse, I'm not a doctor. Okay, when somebody wants to treat you, maybe they've used the syringe or the injection needle to inject your sister or your brother. I'm not saying your sister or your brother has HIV, but they shouldn't use it on you too. They shouldn't use it on you again. So one person per needle. Is that okay? So you should always tell people no, one for the person, then one for me. Then do not use other people's toothbrushes and chew sticks. Okay? Don't use other people's toothbrushes and the chew sticks in order not to have HIV. Now, you have to answer this. Define HIV/AIDS. Write the full meaning of HIV/AIDS. Mention the ways HIV is contracted. Mention ways HIV cannot be contracted. List the ways to prevent HIV infection. Thank you. Enjoy the rest of your day and be happy.